Welcome to day 5 of our Talks on Trauma series. My name is Maurizio.
My name is Zaya, and we have a very exciting conversation today on chronic pain and trauma-informed healing. And our guests for this conversation are
Howard Schubiner. Dr. Howard Schubiner is an internist and the director of the Mind Body Medicine Center and a clinical professor at the Michigan State University College of Human Medicine. He has authored more than 100 publications in scientific journals and books. He's the author of 3 books and has collaborated to develop 2 highly effective psychological treatments for chronic pain.
Jennifer Wallin. She has been working in social services since 1996, and since her own autoimmune diagnosis in 2006, she has focused on persistent disease, illness, and pain. She's currently working for the Primary Care Network and has her own clinical practice. Her focus is in supporting her clients in their wellness within their family, their relationships, and work environment.
And Steven Ozanik is a mind-body health consultant, teacher, health researcher, and author of 5 books. Over the past 21 years, he has helped to teach countless sufferers how to heal themselves through his lectures, books, articles, video, and interviews. He is available for consultation at steveozanich.com.
And Tommy Rosen. Tommy is an internationally renowned yoga teacher and addiction recovery expert who has spent the last 3 decades immersed in recovery and wellness. He's the founder of Recovery 2.0, a global community of people who have found a way to overcome addiction and thrive in life. His first book was highly acclaimed internationally and continues to transform the lives of readers across the globe today.
Yeah.
So, welcome everyone, and Gabor, take it from here.
Well, hello everybody. We've got a wonderful bunch of people gathered here. We're going to discuss the topic of chronic pain. And again, this is one of those issues that are very much trauma related without that being recognized by most physicians and care providers. So the general view of chronic pain is that there's a physical problem that's causing the pain. And sometimes we can find the physical problem, and sometimes we can't. And when we can't, we call it fibromyalgia, or we call it something else. Sometimes we'll call it migraine if it's in the form of a headache. But we always see the problem in biological terms. And so in the case of back pain, that means either giving out painkillers that themselves carry all kinds of side effects, or we offer surgeries. In the case of fibromyalgia, we offer medications. In the case of migraines, again, we give pills to change the physiology of the blood vessels that seem to be expanding to create the pain. In the case of autoimmune diseases, like rheumatoid arthritis, which can cause a lot of pain, of course, we give out steroids to suppress the inflammation or immune suppressants to reduce the activity of the immune system, and of course, painkillers. But what we never think about, when I say we, I mean the usual medical perspective, we never think about the life experiences that may have created all these conditions, like fibromyalgia, like back pain, like migraines, like rheumatoid arthritis. And what I found is that in every case, those conditions go back to trauma. And that's why I'm so excited to have this group here. I'll briefly give you my personal acquaintance with these folks, and then we'll just have the conversation. So Jennifer is somebody I met through my work, and I interviewed her for my book that I'm completing now. Jennifer has suffered rheumatoid arthritis herself, and she's got some interesting things to say about it. Tommy Rosen is a friend of mine. We've met through our addictions work. He's a recovery advocate, a yoga teacher, an author. And in this case, he's not here because of any of that. He's here because he's got quite a story to tell about his own back pain and what happened to it. And probably we'll begin with that story, Tommy, if that's okay with you. Howard Schubiner is a physician, an internist, pain specialist, who's got a very different perspective, and an author, and he's got a very different perspective on pain from the average physician you like to meet, as does Steve Ozanich, who is himself somebody who's experienced severe back pain and would have been condemned to either surgery or a lifelong of suffering had he not met his great mentor, um, Dr. John Sarno, the late Dr. John Sarno. And Steve is now really carrying on the work and the legacy of that particular physician who, again, had a mind body and very, very much trauma based understanding of back pain. That's my brief introduction to the topic and to these people. Tommy, just tell me about your amazing story of back pain and what doctors were telling you and what happened.
Yes. Well, in 2003, I, I'll tell you the story and then I'll tell you the backstory, which is the important part, I think. But
Yeah.
in 2003, I was dancing at a musical concert when I collapsed in extreme pain. Something had happened. My friends, deeply concerned, sort of carried me out. And from that moment, for the next 9, maybe 10 months, I was more or less crippled. So I was sort of struck cripple all of a sudden. Now I could stand up and I could move, but very slowly, always with pain. From the moment I woke up in the morning until the moment I went to bed at night, I was just simply in pain. I was 12 years sober at that time from fairly severe drug addiction. And that's not where I expected to be in my life at 12 years sober. The backstory that you want to know is that the 4 days previous to me collapsing at that concert, I was engaged in another addiction than my primary addiction, and that addiction was gambling. I had been in Las Vegas for 4 nights, didn't sleep, barely ate, dehydrated, utterly stressed, losing money I couldn't afford to lose, borrowing money from a casino that I couldn't afford to pay back. Newly married, just lost my father. You could say it was an interesting moment in my life.
A perfect storm.
Perfect storm. And the perfect storms are the perfect way for somebody to be rocketed into a new level of healing if they pay close attention, or for you to meet your demise. And I feel like I really had come to that place. I was going to go one way or the other. So for 9 months, I live in Los Angeles. So at that moment, I started to see healers of every kind: massage therapists, acupuncturists, traditional Chinese medicine. Really, I would sort of go see anybody. And my mantra at the time was, please fix me. Please, can you fix me? And unfortunately, with each new person that I went to, I would hear another diagnosis, another name for what I had, or confusion about what I had, another way through it, but nothing was working.
And
And I was becoming more and more desperate.
what were the doctors telling you?
Well, these different healers would say things like, practice yoga. Another one might say, no yoga. Someone would say, do this kind of training. Another would say, no, you're moving too much, you're aggravating the tissue, and you're creating more inflammation in the body. But no matter what I tried, including dietary regimens, all kinds of things, nothing was working. I was becoming more and more tight, more and more desperate, and very frightened. I finally broke down and I went to Cedars-Sinai Hospital here in Los Angeles, very prominent facility. I got an MRI. For me, Western medicine, no offense to anybody, is just sort of a court of last resort. It's not a place that I have put my faith in what I consider to be true healing. But I do recognize Western medicine being very, very important when it comes to physical trauma, huge injury, any kind of operation that's necessary. If you break your leg skiing, we're really glad to have Western medicine. But for this kind of thing, it would be the last place I went. But I went there.
Mm.
And I stood with my wife in front of a surgeon and a radiologist. And they said to me, "We don't know how you're standing right now. You have severe degenerative disc disease. You have profound herniations at L3, L4, and L4, L5.
These are
You
levels.
are,
These
I'm
are
sorry?
levels. These are levels of the spine that.
Yeah, so in the lumbar, in the lower spine,
Yeah.
I had in two areas between three different vertebrae, I had these protrusions, these herniations of the disc, which were pressing into the spinal cord. And that naturally, your body will send out a pain signal. This is very dangerous, and so that you pay attention to that area. And they said, "You are going to be on drugs for the rest of your life." That was a direct statement.
Wow.
And we're going to have to operate on you pretty soon here. We're going to have to help you because this is and this is what they said, this is a progressive disease and it never gets better. And my new wife, who's still my wife today, Kia, and I sort of dropped our heads. And for me, that was one of the when I speak about the different bottoms in my life, that was a bottom. So my life was over as I had known it. I'd always been very athletic and always been a kinetic sort of mover through the world, and that was ending now. About 3 days later, a friend of mine who I'd been speaking to for months about my back pain said to me, "If you really, really want to fix your back, you should go see this man named Guru Prem." Guru Prem.
So, Tommy, thank you. I will
Yes.
stop here. We're going to come back to you. No, that's okay.
Yes.
We're going to come back to you and Guru Prem. I really want to hear that story.
Sure.
It's an amazing story. But what I'm going to ask now is for Howard and Steve, both of these people that work with back pain a lot, to comment on what they've heard so far and just how they see the situation. Like Howard, as a physician now, you've heard Tommy's story.
Yeah,
What would you say about it, and how would you approach it?
it's really there. It's really sad, that doctors don't understand the data that's out there for everyone to see. That if you're in your 50s, 80% of healthy, normal, pain-free 50-year-olds have degenerative disc disease. Degenerative disc disease does not cause pain. Degenerative disc disease is normal. It's like graying of the spine. You get gray hair as you get older. You get degenerative disc disease as you get older, but this
So it's
does
not.
not.
So it's not a disease, is what you're saying.
Not a disease at all.
Yeah.
It's a complete misnomer.
Yeah.
And people are getting operated. By far, the most common cause for surgery, back surgery, is degenerative disc disease. And it's not a disease. And even 40% of 30-year-olds have degenerative disc disease. And bulging discs are also extremely common. So 60% of 50-year-olds have bulging discs with no pain. 40%, 50% of 40-year-olds have bulging discs with no pain. So for doctors to not understand that is just, it's beyond shameful. I mean, I want to say criminal, but I'm just launching into hyperbole here, Gabor.
So what you're saying though is that the X-ray findings are real, but they have nothing to do with the pain in most cases.
Correct. We did a study recently where we evaluated 220 consecutive people with chronic neck and back pain. And we used the standard, medical criteria, and then we used our criteria that Steve and I use when we evaluate people. What was going on in your life at the time? Does the pain shift? Does it move? Does it come? Does it go? All the things that we look at to understand and confirm that the brain is causing pain rather than the back. And we found that 85% of these 220 people had nothing wrong with their spine.
Wow. So what you're saying is that when people say it's all in your head, in a sense, that's true. Not in the sense that they're imagining
Yeah.
it,
No.
but in the sense that it's a mind-body process.
Well, all pain is generated in the brain.
Yeah.
All of our sensations, our hearing, how we see, what we feel is all generated in the brain. And it's a question is it being triggered by some disease, injury or something, or is it being triggered by stress and trauma? Is it an alarm? Is it a message? And Tommy was clearly getting a powerful message from his brain in the form of back pain.
Thank you. So, Stephen, can I get you to pick up on that theme? Your mentor, Sarno, who was a rehab specialist, wasn't he? A physiatrist.
Yes.
He developed this whole approach, very much aligned with what Howard is saying here. Can you just comment on Tommy's story from that perspective?
Sure. What Tommy said there, I've heard tens of thousands of times since the past 21 years ago when I healed.
Yeah.
It's extremely common, and I myself had back pain for 30 straight years, debilitating back pain for 30 years. I had tried everything, even hung upside down like a bat. And I never tried to suck the blood out of anyone's neck, but in the late 1990s, my left leg was paralyzed. I had foot drop and lost the reflexes. The only thing I had was the top of my quadricep. And of course, we did an MRI and it showed a pinched nerve. And so I was weeks away from the final surgical consult when someone introduced me to Dr. Sarno's work. And of course, I rejected it like most people do because I saw proof on the imaging that I had a pinched nerve. Well, luckily, I listened to the good doctor and the pain went away. It's been 21 years since that happened, and I've seen tens of thousands of people come through, either emails or in person or phone calls, and they're all healing. And it's not just pain; it's disease as well. It's much bigger than that because
And
these
what
things are just effects.
and what did John Sarno say to you, in effect?
That I was full of rage,
Hmm.
which I didn't know because it's something called repression. And I know everyone called me the calm one, the kind one, the cool one. But having the back pain showed that there was a lot of things going on inside there. But I didn't believe it. But he was ultimately right, of course. And so that I think the main thing of the dozens of things that he did to change the medical industry forever is that there's nothing wrong with this. That these things like pain and disease are effects. They're not causes.
Mm-hmm.
And once you treat the body or the brain, you're not getting to the cause of it. And it's just going to keep circulating in what he called the symptom imperative, which I think was worthy of a Nobel Prize in medicine there. And so everything Tommy said, I agree with, except all the way up to the Guru Pram, which I don't know anything about, which I'll be interested to hear about. But I've taken the different route, the spiritual route. And I've seen just about everybody heal that comes through here because I'm not in the medical industry. I'm
Yeah.
not confined to certain protocols. Like doctors are, of course, tied to certain protocols, and so I see it a totally different way, which I believe is why I'm here on the Brady Bunch.
Now, Tommy, Steve, I mean, your suppressed rage, what that is an impact. One of the impacts of trauma is that people repress themselves. So we're talking about trauma here. I'll talk to Jennifer now because you actually had, Jennifer, you didn't have some vague pain syndrome. You had what was diagnosed as a well recognized medical condition, rheumatoid arthritis.
Yeah.
And you've learned a few things about yourself and your history and your relationship of your history to arthritis and to the pain that arthritis caused you. And you're another person who, at this point, are no longer relying on medical treatment. And you were another person who were told, I believe, that you'd have to be on medication for the rest of your life,
Yeah.
and you're gonna have this disease forever. So please just tell us a little bit about your story.
Yeah, so I got diagnosed about 16 years ago after my husband played professional hockey and he had a career-ending concussions. So we were dealing with the brain injury, and then I had two babies back to back. So I had two kids 14 months apart. And just pushing through life at that point. I was 28 or 29, I think, and just wasn't being very mindful at all. And all of a sudden, just really overwhelmed, I think, with dealing with my husband's brain injury, dealing with the kids. And we were on our way home from the zoo one day and got rear-ended. And that night, my shoulder blew up. And so I thought I had maybe hyperextended it in the accident. I went to the hospital. They couldn't find anything. I just wanted it documented in case, it persisted. And then it went away. And then for the next probably about 4 or 5 months, it kind of jumped around joints. I went to my knees, to my hips, to my jaw, to my shoulders. And then in about 6 months after that car accident, I ended up in a rheumatologist's office. They said the normal RF factor was 15. Mine was like 156. And I had 26 joints that were inflamed and, unable to do much of my own, the babies, picking them up and getting them out of the crib in the morning. And they said, yeah, it's definitely rheumatoid. I went to the Mayo Clinic in Phoenix and got a second diagnosis and was put on, at that point, I was put on methotrexate, which is a pretty serious drug, and was told because there was a protein in my blood and because of my high RF factor that it would be very likely that I would never be able to get off this medication. And since then, I've been told from a couple different rheumatologists that because I've tried to go off the medication and it has never gone well for me. So I've been told, like, stop doing that. You're going to hurt yourself and you're going to have permanent damage. And so
this disease will never go away.
This disease is never going to go away. Stop being. I actually had one rheumatologist tell me I was playing Russian roulette with my health.
Now, I will come back to your story afterwards because if I understand you right, you're no longer on medication. Is that the case?
No, I went off in June of this
Okay.
year. So I'm about 4 months. Thank you. Yeah. 4 or 5 months completely off of it and zero symptoms.
And for a long time now, even you're on the medication, but for a long time now, you've not had to increase the medication,
No,
and you have symptoms have been very rare.
absolutely. Yeah.
Okay. Now I just ask you one more question. When you were seeing all these doctors at the Mayo or wherever, anybody ever asked you about your childhood? Any asked you about trauma?
No.
Anybody ever asked you about any stress in your life?
I think my general practitioner, she's amazing.
Okay.
She definitely would, wonder about, because she also saw my husband, so she knew, and she
Okay.
was the doctor for my babies, so she knew the stress, but
Okay.
not
Okay.
as related to the rheumatoid.
That's what I mean. I meant it's related to the rheumatoid.
Sorry, yeah, no,
Nobody asked you about
no,
that. Anybody asked you about your internal emotional life?
no.
Okay. And these are just all the questions that I think Steve and Howard and myself as well, these are all the questions we have learned to ask now of people with any syndrome that involves chronic pain. Jennifer, thank you. I'm going to come back to you.
Yeah.
Tommy, now tell us about your encounter with the guru and what happened.
Can you hear me?
Yes, thank you.
Okay. So there I am, feeling somewhat hopeless, and a friend suggests that I see somebody named Guru Prem. I've been to 100 people before this, and I'm from New York City, somewhat skeptical and cynical as it is.
Yeah.
And I told my friend flat out, I'm not going. I'm not going to see Guru anybody. Thank you. But the fact is I was hurting and I was quite frightened, as I had said.
Yeah.
So I kept it in my mind. But that night, that very same night, my wife and I went out to dinner across town in Los Angeles. There was a woman sitting next to us at the table right next to us. And she was very bubbly and she introduced herself to us randomly. Hello, I've just come to Los Angeles, she said. We said, oh, well, welcome. What brings you here? And she said, oh, well, I hurt my back and I'm going to see a man named Guru Prem. That was the same night.
Yeah.
So I had spoken to my wife about my friend's suggestion. My wife looked at me and she said, you call this man. I called Guru Prem the next morning and I said, apparently I'm supposed to come see you. And he said, well, we better get you in here then. So I went to his office. It was a Wednesday in December 2003. I knocked on the door and there he was. And whatever you have in your mind as a guru, this was it. He opened the door, big long beard, salt and pepper beard, glasses, the turban, white robes. I mean, it was the whole thing. I was literally, my internal dialogue was, it cannot have come to this. I can't believe this is it. Is this my savior here? I was so cynical. I was so scared. And Guru Prem asked me to sit on the floor on a yoga mat. And I could barely get down. I could barely get down to the floor, truthfully. And when I sat down, he was sitting on the other end of the yoga mat. And for the first time, I really looked at his face. And there was so much presence, so much love, and so much contentment, which I don't think I'd ever really seen before like that. I don't think I'd ever seen a content person. I mean that in my life.
Yes.
And I looked at him, and in that moment, I wasn't struck better, but I knew that I was going to be okay. And I said to myself, I need to follow the instructions of this person. And very long story short, well, he said to me, you know, the first thing he said to me is, I can tell how you're going to die. And I said, okay, you know, you've got my attention. And he said, you're going to die on an exhale. And I thought about that. And I went through a bunch of death scenarios in my mind. And in every case, the last thing I was going to do was exhale.
It's not called expiration for nothing.
Exactly.
Yeah.
And he said, and you came into this world on an inhale like everybody else.
Yeah.
And what he told me was, from this moment now forth, the more conscious attention you pay to the breath, how you're breathing, the more you learn its secrets, the more you learn techniques for changing your emotional state, managing your stress, and changing what later on we would call a sort of a frequency, if you will. You have to shift. The more that you do that will determine the length, the depth of your healing. These are the words. The depth of your healing and the length to which you can go in this life.
Mm.
And he was saying that about the breath, which literally has been under my nose my whole life, which nobody ever pointed me to in this kind of way. Whereas 4 days, literally 4 days previous, these guys had told me, you will be on drugs for the rest of your life. There was no hope in that. There was no possibility in that. And because most of us put our faith in someone of authority in that position, you're really in trouble because you start to believe that in your mind. So 4 days later, I'm listening to a man tell me, no, you can heal. You can heal. But you're going to have to work at it, and you're going to have to learn some things. And it's going to be about changing the way that you live and the way that you process the world around you. And that's what we're doing here today, Gabor, is exploring this idea of how trauma affects the way we process the world around us. Because I was processing the world as a stressful place. To me, signals and input and data was going into my body and creating a tightening in my body and a stress response in my body. And I did not know that I was doing that for a lifetime.
Thank you, Tommy.
And there I was, 12 years sober. Yes, I had put the drugs and alcohol down, but I hadn't learned how to put my stress down.
Which is, I think, what you and I would agree is the difference between abstinence and sobriety. So for 12 years, you were abstinent, but you were not sober.
I was, let's just say that my life certainly had improved greatly from the life of a drug addict.
Yes.
And yet I hadn't gotten what we now refer to as true recovery.
Right.
I hadn't yet recovered.
Yes.
So this, and to listen to these gentlemen here. I'm sorry, my glass. I don't have my glasses on, but
Howard and Steve.
Howard and Steve, they're speaking the language that I was able to gather through going through a healing process, because 90 days, just 90 days after meeting Guru Prem and following his instructions, my back pain went away. 12 years later, in 2015, I would go and have another MRI to have a little look-see what's going on in my spine. And these two gentlemen here will tell you what was going on in my spine. Nothing had changed. Nothing had changed in my spine. Maybe the degeneration had become a little bit more pronounced because, as Steve was saying, as we get older, there's changes in the body. So maybe there was a little less space, but the herniation's still there. If you look at the spine, it's amazing. It's just still my spine as it was in 2003, but no pain. So it tells us very important lessons here that, as I look at what it was for me, I could tell you that I was, for me, diagnosing myself with what I know now. I was in a lifelong condition of stress that led to a neurological tightness through the body, which affected the tissues of my body, created great tension and strain. And I got into a tension pattern.
Yeah,
The stress of my life wrote itself into my body. And until I was able to break the pattern of stress created by trauma, my healing was yet forthcoming.
Which we can call post-traumatic stress. Okay, well, thank you. That's great. Tommy, we'll come back to you again. Howard and Steve, now, I'll get you to just now comment on, not just on Tommy's story, but given what you understand now about pain, when somebody like Tommy comes to you, what are each of you going to go to do with somebody like that, or what are you going to suggest to them? What avenues do you want to open up for them? Howard, let's start with you again, and then we'll come to Steve.
I mean, to me, all healing comes with 4 steps. The first step is explanation and understanding. And so as a physician, I'm exploring people's lives. I'm exploring their bodies and looking for the clues that suggest that their pain or their fatigue or anxiety or depression, insomnia is due to brain-related neural circuits as opposed to a physical condition. And even if it is a physical condition, looking for the clues that suggest that their brain, because of stress and trauma, and then later life stresses on top of childhood trauma, how that activates the danger alarm mechanism in the brain. And when people feel unsafe, their brain is going to try to protect them with some symptom. So it starts with an explanation and understanding of what's going on. And then it's methods of healing. So whether it's a presence, whether it's spiritual healing, whether it's ayahuasca, group therapy, etc. What I do is two major components. One is pain reprocessing, and the other is emotional awareness and expression. So we're looking at how the fear, and Tommy mentioned the fear that he was in, how the fear drives the danger signal in the brain. And we're helping people lower that. And we just finished a randomized controlled trial in Boulder, Colorado, where 75% of people with chronic back pain, average duration of pain of 10 years, 75% of them were pain-free in 1 month using this pain reprocessing after understanding, evaluating them, explaining to them that it's not in their head, but it's in their brain and it's real and they can reverse it. And then as necessary, we're helping people reprocess trauma and reprocess the emotions and the rage that Steve was talking about. And then the third step is connection and caring and compassion and helping people develop compassion for themselves. And it's critical to do that. And the fourth step is hope, optimism, and resilience. So if you go through those 4 steps, you're really healing from the inside.
Howard, let me ask you a question. You and I were both trained as physicians.
Right.
If your training was anything like mine, you didn't get a single lecture on any of this stuff.
Correct.
Nothing about trauma, nothing about how trauma and stress relates to pain syndromes. This is and the funny thing is, this is despite all kinds of scientific research showing these connections.
Yeah.
So it's not like you and I are sort of outliers when it comes to the science, or Steve is. This is a lot of science has shown us. What gives? Like, like we have all this evidence.
No,
First,
it's not that the doctors are malintentioned, the physical therapists. It's what they were trained in.
yeah,
There's an incredible myopia. They can only see what they expect to see, and they
yeah,
can only know what they expect to know. And
yeah,
this paradigm shift is going to happen because there's millions of people in chronic pain and all these other associated conditions like anxiety, depression, chronic fatigue. Long haul COVID now is sweeping the world, right?
yeah,
Uh, because of stress and emotions.
yeah.
And it's going to change because we're right. The science is there, and we're doing some of the research to help further that from the medical point of view. But the people who are going to drive the change are people who are suffering.
Mhm.
The people who are looking for the people like Tommy and Steve and Jennifer who have to heal because their lives are at stake.
Steve, thank you, Howard. Steve, coming back to you now. Um, you told your own story of severe pain and how you're going to be in pain for the rest of your life until you met John Sarno, and all of a sudden you weren't in pain for the rest of your life. And I've taught you worked with hundreds and literally thousands of people. When somebody comes to you with Tommy's presentation, Tommy's story, how do you begin to work with them?
Well, of course, I'm not in the medical industry, so I don't have the protocols that Dr. Schubiner has to follow.
Yeah,
And so I can't diagnose anybody. I'm a teacher, basically, a
yeah,
teacher of TMS and a teacher of presence. And so um, I try to get them away from the scientific model as fast as I can, and these things like evidence-based medicine, because they deal with something called reductive materialism, and which cannot really offer up.
Explain that, would you?
Well, they're trying to break it down into the atoms and the matter, the matter, the
Yeah,
biological matter of it. We can fix it somehow.
yeah,
But these things don't give one iota of understanding on how the physical body or the physical brain gives rise to consciousness. And
yeah,
so increasing consciousness and increasing awareness toward fuller awakening, that is the deepest, more fully healing path that I've seen. And so, as Dr. Schubiner said, it's ultimately knowledge, no matter he comes at it from a different direction than I do, but we both agree that it's knowledge eventually, because that's the only way to really full awakening. And so I've seen people healing from stage 4 cancer and MS and deafness recently when they realize it's not a physical body problem. It's more like a dysfunctional consciousness thing. Anita Morgiani told me she has thousands of emails from people from around the world whose cancer disappeared when they realized that it wasn't a disease through her work, that it was a deep-seated conflict in the emotional process.
yeah. You know what? So I've talked to Anita myself, and I interviewed her for my next book, and I agree with you about all these other diseases, how they do represent mind-body processes. But for this one, I'm going to keep focused on pain.
Okay.
Okay, and so somebody comes to you with pain, like say Tommy would have went to Guru Prem. What do you say to them?
I would, first of all, ask them if they've ever heard of TMS, which most of them have.
And
Dr.
TMS,
Sarno's,
TMS
the,
is
the mind-body syndrome, that was Dr. Sarno's brainchild.
yeah.
And most of them have by the time they found me. They've tried everything else. And
Let's let's assume they haven't. Okay,
okay,
like Tommy had never heard of TMS. Tommy comes to you. What are you going to say to him?
would you, first of all, I would have to say, have you gotten checked out by a physician?
Yeah,
Because you have to be responsible. We own the responsibility for our lives, and so we have to be responsible people. Are you in danger? First of all, if they've heard of TMS, they know that they're not. And so I would ask them, what's going on in your life right now?
hmm
And but I think of all the things that Dr. Sarno discovered, I think the most important thing is the personality. He
hmm
uncovered a personality disorder of obsessive compulsive addictive person, which they all are. Every person that's ever come to me has these traits. And of course, you can't change your personality. It's simply awareness of what's going on in your life, and that nothing's wrong with me. Half of the people would probably heal just knowing nothing's wrong with them, because the
Mhm.
fear would drop. Of course, when the physician tells them something's wrong with them, the fear goes through the roof and the symptoms get worse, especially if they tell them they're not going to heal.
Mhm.
And so I would just talk to this person and try to explain to them what happened to me, what Dr. Sarno discovered, what I've seen, and would they buy into it? Because most of the people won't. They won't buy into it. Most of the people won't, and most of the physicians won't,
Mhm.
because they need their symptoms. They need it. Because as Dr. Sarno proved, it's a diversion away from the unwanted emotional towards the physical. And so
Mhm.
it's an obsession, it's a distraction, just like gambling, just like drinking.
So people have trauma-based grief or pain or rage, and rather than experience those states, they divert the energy of it to a physical symptom. Not that they do this consciously or deliberately, but that's what you're describing.
That's well said. And it's not just a obvious trauma like a death of a loved one or a loss of a limb or something. It's more
Right.
like this personality that puts self-imposed pressures on themselves to be good all the time through moral scrupulosity and these demands. It enrages them. At some point, it becomes traumatic to them to live that way. It breaks
Yeah.
them
Yeah.
down mentally. And so they start hosting symptoms.
Yeah. So I'll turn to Jennifer now, because that's what Steve has just said, pretty much describes your story. So that I'm not going to ask you about the details of your childhood trauma, but you had a traumatizing childhood. And then you were one of these people that was very nice and very dutiful and took on everybody's problems and was responsible for everything. So, what have you learned about? And then your rheumatoid arthritis came along to warn you about all that in a certain sense. I may be interpreting, but that's what I understand your story as being. So, can you talk about then your diagnosis and what have you learned since then, and how you put these connections together, and how that's helping you, and the work that you're doing yourself now?
So I think after reading your book, after I got diagnosed, I started sort of seeing the link between some things that happened in my childhood that I experienced as traumatic. And you said something in the course that I took the compassionate inquiry course, and one of the things that really resonated was fish don't recognize water; they swim in it.
Yeah.
And I think you're not doing it as a martyr, caring for others and doing for others. You're just not considering what your needs are. And meanwhile, you're feeling internally quite rageful or angry, but you're not really giving yourself permission to express that or to even know what your need is, because you're not considering what your need is. So I think what we did with the compassionate inquiry is every single day. I mean, I had done a lot of work, I had done a lot of the alternative therapies and that kind of thing, but with the compassionate inquiry for 365 days, you had us put our hand on our heart, or maybe I just did that, but to recognize every time we had a feeling, and whether
You
it
did
was
you
anger.
you did that. I didn't have you do it.
Okay, well, I did that. I learned
Okay.
that too from the work of Kristen Neff. She does the compassionate.
Yeah.
So when I felt an emotion, I would feel it, and I would just ask myself what I needed. I would just say, "What is going on for you, Jennifer? What's the need for you right now?"
Mm, mm.
And so when my jaw, the one day when my jaw kind of, I felt there was a lot of inflammation in my jaw, rather than push forward and be angry about it or take a bunch of Advil, I would lay on my bed and I would just feel my jaw, and I would just talk to it like I would a friend and just say, okay, what's going on, what's happened in the last couple of days, what do you need? And I would start to just do a more compassionate inquiry. And I found that when I did that and then started adjusting things in my life, it would quietly just go away. And so I felt like, and the more research that I had done I teach a pain program in my local community and work with people one on one, and the more I saw those personality characteristics through every client that I ever worked with, I started realizing how I was contributing to my disease having something to say, and that if I used it as, in your words, Gabor, as a guide rather than an enemy, that it actually had a lot of really wonderful things to tell me. I just had to sort of be still and, as Tommy mentioned, just connect to the breath and really just calm my nervous system down so it didn't have to scream at me anymore. I could just say, all right, I can keep you safe. I can address what your needs are and do some breathing. And when I started, doing some breath and stretching work every day and just taking time out to care for myself, I feel like the diseases has, and again, in your words, Gabor said, I'm not so needed anymore.
Hmm.
And so I wouldn't say I'm healed from rheumatoid arthritis. It may creep up again, but I at least feel like very empowered to know that it's giving me a message and that I have an opportunity here to figure out what that message is.
So you're not powerless in the face of it. It's not just,
Absolutely not
yeah.
powerless. Yeah, feel like it's been very much a gift in my life. It's why I became a therapist. It's why I do the work that I do, and I don't know where I'd be without it, quite frankly.
And when you work with people in along these principles, what's your experience? What's their experience?
I think this very similar that most if not all of the people that I work with have had some childhood trauma, and they've just minimized their needs. They've minimized their own suffering, and they've never connected that physical piece of what they're dealing with the emotion. And so it's such an awesome thing to be able to sit down with someone and say, you know what, you can say no to family dinner on Saturday. You can start setting boundaries in your life. You can start healing, and that can impact your I talk a lot about the biopsychosocial model, which Lorimer Moseley presented. And just if we look at influencing our psychosocial, the bio can change. And
Yes.
I find that's a much more empowering message to give them than, sorry, there's nothing we can do. This is the way you're going to be for the rest of your life.
Well, thank you. I will finish my questions in a moment. I just want to go around one more time. And so, Tommy, you've spoken very articulately about your experience. At this point, if you met somebody with chronic pain, and if you just wanted to give them the gist of what you have learned, what would you like to tell them?
I would say, first of all, there's a way through any block. I would express to them that the body, as much as anything, is a healing machine.
Hmm.
It's what it does.
Hmm.
It's mostly what it does. It heals all the toxicities, the infections, all the stressors. The body actually does that. And when it doesn't do that, or if you're experiencing chronic pain, it's because there is something blocking it from doing its job. And so the only job really for us is to identify and remove the block. If that's a spiritual block, a disconnection of some form, a sense of lack, or an incorrect perception of oneself. If it's a physical block, there are physical realities for sure. We're speaking about trauma and psychological, spiritual realities based in experiences we've had in the past. There are also physical traumas, actual physical traumas that play a role here as well. Emotional, energetic blockages. So, in my work, you use the word trauma, I use the word addiction. I actually mean the same thing you mean when you say trauma, when I say addiction. It's the same thing to me. Is if we're going to resolve our addiction problem, we're going to have to resolve our trauma problem. If we resolve our trauma problem, our addiction problem resolves itself. So from that perspective, we know that addiction works upon us in 4 dimensions: mind, body, spirit, and in our relationship with time. Understanding that, if we try to take a single-pronged approach to addiction, like we'll approach it just psychologically, your approach will be missing some key elements. Or we'll approach it just spiritually. Again, you'll be missing some key elements. So there's a holistic approach. There is a way through every block. This body heals itself. I would say don't panic. And one thing that I think Howard and Steve and Jennifer and you are all about in your work in the world is the magical ingredient that we haven't necessarily called out, which is love.
Mm.
And that when I, yes, is right behind Steve there. And when I look at the moments where I've been able to make a leap forward, or someone was able to reach me, or I was able to heal anything, love was always a key ingredient. Whether that was Guru Prem or memories of my parents or any other teacher or doctor or healer that's come to help me, or my wife or my friends or anyone in my life, that, let's face it, that without that, we're really in trouble as human beings. We have to have it. And so that's what I
So,
would say to somebody is, don't panic. Don't panic. You're loved. You're loved here in this moment. And let's do the work to remove the blocks. Let's find out what they are, and we'll work one day at a time, and we'll make progress together.
thank you. Wow. Somebody should write a song called "All You Need Is Love." Um,
It's a good
why
idea.
didn't somebody think of that? Um, Howard, how many lectures on love did you get in medical school?
Not a lot, Gabor. Not a lot. It's the brain is either operating in safety or in danger.
Uh-huh.
And we have very powerful fMRI studies of the brain now showing that when people feel unsafe, when people have emotional trauma, the activity of the brain triggers a danger alarm mechanism.
Yeah.
And it triggers pain in the exact same way as does a physical injury. And it's not only, personal in the sense of something that happened to people, but it's also societal, as you well know, and you point out so eloquently. Injustice. Uh, I just, recently I spoke to a young woman who's having all these kinds of pains, and she was living in the States, but she's Canadian.
Mm-hmm.
And she moved back to Canada, and all her symptoms disappeared.
Mm.
And she said, I didn't feel safe in the United States because, well, we know the United States has a variety of ways of making people feel unsafe in a lot of ways. And if people feel unsafe in their work, people feel unsafe in their own skin because of racial injustice, and we're working on this issue as well, um, the brain is going to react as a protector, and our brain is going to send a message. And as Tommy said, it's up to us to figure out what the message is. One
And
of the things I'm doing is teaching other doctors. So I run training programs for physicians, nurses, chiropractors, physical therapists, social workers, psychologists, and how to assess people and how to help understand the brain and how the brain works and how to assess people. And so we can know when they're not structurally damaged and how to talk to people with love and caring and non-stigmatizing ways
mm,
so that they can begin the process of recovery and healing.
you know, not only can the brain trigger pain, it can also trigger inflammation, physical inflammation.
Sure.
They call that
Absolutely.
they call that neurogenic inflammation. And then the doctor says, "Well, you got this inflammatory disease." Uh,
Right. Because it's a neuroimmunologic system, right? Psychoneuroimmunology. And that field was started back in the 1960s.
yeah. Now, I'm going to ask you one more question, just by the by. You mentioned long COVID. Now, I haven't talked to many medical colleagues about long COVID, but my view of long COVID, I'm not talking about the acute infection. I'm talking about what
Right.
they call long COVID, is actually acting like an autoimmune disease. And I believe it has stress as the basis of it, so that the virus may trigger the immune system, but that immune system is triggered because it's been under long-term stress. Is that similar to how you might see it?
Well, actually, I mean, that certainly may be the case, but the people that I've seen with it actually don't have an autoimmune disease. They don't have inflammation. They have a mind-body syndrome.
Okay.
They have symptoms with headache and fatigue and
Okay.
brain fog and can't concentrate and stomach pain and out of dissociation. None of those are, they're not like rheumatoid arthritis
Okay. Okay.
in that sense. And it's about 10%. And for example, there's a really famous study where they gave people a pretend car accident. They put people through what seemed to be a car accident, and 1 month it wasn't a car accident. They didn't have any movement of their body, and 1 month later, 10% of them had neck pain. 1 month later,
And my guess is that the 10% who did had a predisposing trauma-based.
exactly,
Yeah. Okay. Well, okay, I can accept
exactly,
that. Yeah. Okay. So it's not an autoimmune disease, but it is a stress-related condition. It's not a direct.
in my
It's not a direct effect of the virus as such.
correct, in my opinion. And many of the people who have long COVID didn't never had COVID, or they had a very mild case that recovered quickly.
Interesting. Thank you. Okay, Steve. So we'll cycle back to you now. You said very eloquently what your approach is and what you learned from Dr. Sarno. But there's also, whenever I speak with you, I sense a deep passion. You're just passionate about this stuff. Just tell us about that, okay? What calls you so much?
That's a good question. No one's ever asked that before. Um, Everybody here knows that the most rewarding thing is helping someone to heal. It's it's the most beautiful thing you can ever feel. Sometimes I think that's why we're here, actually. That's
Yeah.
why love is so important. But there's an obligation. When you know something that can relieve somebody's suffering, you have an obligation to at least try. So many people won't accept it. They have to hit rock bottom like Tommy did. And like I did, I hit rock bottom because, the wound is where the light enters the body. And so there is a deep passion there because I'm driven by more than material things. And so I'm watching people heal. I've created a list of videos of people who were told by their doctors you will never heal, and they're all healed. But it's an uphill battle, as Dr. Schubert knows. It's an uphill battle. Everybody here knows, because the industry is built upon money. And the money's made in treating, not in healing. Healing doesn't really take money. And so Dr. Sarno didn't believe his ideas would ever take off, sadly, because the industry is run by money. And so, it's David and Goliath, but it's fun being, the little guy.
Did he get, did John Sarno get discouraged, do you think?
Yeah, he used to say it's lonely there. Lonely. He told me, Steve, the doctors wouldn't even know what to do with the information if you told them it was psychological in nature because they were never trained in it.
Mm-hmm.
There needs to be a hybrid doctor. I think that's the future doctor, a hybrid of some type. Because
Go ahead.
Because, they specialize. Well, I think, in my opinion, the specialties really hurt our health when we started to specialize. Big toe pain, next big toe pain, little toe pain, things like that. Fibromyalgia, the field that Dr. Schubiner mentioned a few minutes ago. That's when it started to fall apart. And he said, the minute that they leave their general practitioner and go to the specialist, I've lost them for good. I've lost them forever. Because that specialist is bound and determined to find a physical cause when it is almost never a physical cause, in my experience.
Well, thank you. Thank you all very much. Just an illuminated conversation. Jennifer, what would be your final comments on this question of chronic pain?
If somebody asked me, you'll have to go back to the question, sorry.
Well, so what would you like to tell the world about what you've learned about chronic disease and chronic pain and the possibilities of healing?
Yeah, I think being open to the possibility, right? And just the amount of influence that we have. And so, not discounting their own intuition because a professional has said, this is your life and you're in this box and you're not able to come out of it. So just, finding that bravery and courage to come out of the box and consider, the ways that they can influence their own life and having compassion for themselves and, just attaching to that intuition, that gut feeling. And in doing that, just being open to the possibilities and seeing your physical health as a part of your mental health, that they're not actually different. And I think it doesn't happen overnight. As I've shared with my own journey, I'm 16 years later. And so being really patient with the process and trusting in that.
Well, thank you. Afterwards, we're going to ask Zaya Murcio to create a list of resources. So specifically, if any of you have resources to suggest, and I know Howard and Steve, you do, including the work that you do, we want to put them on the website for people to consult. Zaya Maurizio, I'd like to bring you in now to see if you have any questions from a lay point of view for these four wonderful people.
Conversation. I just want to share this very briefly, Gabor. I don't know if you know, but
This is a good one.
At your first workshop, and this conversation just completed the puzzle of my childhood chronic pain completely. Since I was a child, I had a terrible pain in all my joints, wrists, ankles. I've been to every possible doctor, every possible diagnosis. Since I remember myself, that was my journey every week to the doctors. Until age of 16, they said, okay, you're going to be basically by age 40 crippled. Like you have a degenerative arthritis or something like this. Except one thing I noticed, that when I was away from my home on camps, skiing, or in the sea, the pain disappeared. Was never there when I was away from home. So at age 20, I left the country and I left home, and the pain, can't realize even what was going on until I was at the workshop with Gabor, and I was like, oh my God, this was really trauma response. And just now this conversation completes for me that puzzle of my
I love she was saying that the doctor was saying, yeah, you have the pain. This is it. When it's the sea air that does it for you, that cure you. Well, it's the mountain air that cures. So every time she was out of the house, all of a sudden it's the special air. It's the air of the house that made you sick. That's the part that
I know somebody with multiple sclerosis who is symptom free until she meets her mother, and then she becomes paralyzed.
Wow.
So okay, you guys. Any other? Do you have any other comments or questions for these people?
No, that's
I mean, seriously, I think this conversation should become with the movie part of the curriculum of every training of any doctor, and we do anything we can to make it happen. So because
pain and disease is not a cause, is an effect. Like this is like I'm taking this away so clearly and loud. We all need to know that. Remember.
Okay, well then it just remains for me to thank everybody for your participation. Jennifer, Tommy, Howard, Steve, and as always, I am Maurizio. Thank you.
Everyone,
thank you
so much.
Thank you,
so much.
Gabor.
Thank you.
Bye bye.
Thanks.